Well, tonight, patient care problems revealed in Virginia's state hospitals. A new report on its way to lawmakers shows how the state psychiatric system is understaffed and overwhelmed. Alex Littlehales joins us in the studio, revealing more about the investigation's findings.
Yeah, Janet, this report shows how an increasing demand for patient hospitalization, which is out of the hands of hospital staff, is putting the psychiatric system at risk. Just one example is the state's hospital occupancy rates. So the threshold needed to operate safely, quote unquote, sits at 85% occupancy. But the state's average, well, that sits at 97% occupancy this year, including several hospitals working at full capacity. New findings published by the Joint Legislative Audit and Review Committee outlines how the patients and staff of Virginia's psychiatric hospital system are at risk. A growing demand but plateauing supply for inpatient beds, putting an increasing strain on the state's 9 psychiatric hospitals. For the 2023 fiscal year, more than 8,000 people were put on a state hospital civil wait list because an inpatient bed wasn't immediately available. On average, those patients waited more than 40 hours before they were admitted to some kind of medical care.
Some of those individuals ended up at the state hospital eventually. Some of them likely went to a private psychiatric hospital, but then there are some that we know of that never ended up getting the treatment that they needed.
Law enforcement drop-offs are adding to the problem as well. These are cases where officers place someone at a psychiatric hospital even before that patient is medically cleared. This increasing demand stemming from state law that does not allow patients under a temporary detention order to be denied admission to a psychiatric hospital. Drew Dickinson, one of the report's authors, telling 13 News Now private facilities should be tapped to lighten the load on psychiatric hospitals.
If a portion of the unused beds in 2022 in the private psychiatric hospitals, if they were used, both the private and state hospitals would have been able to operate at under that 85% level.
And another recommendation for lawmakers next session is increasing the number of nurses at psychiatric hospitals in the state of Virginia. I'm Alex Littlehales for 13 News Now.
All right, Alex, thank you. And data received by 13 News Now shows Eastern State Hospital in Williamsburg saw roughly 600 admissions this year.